Hi, this is Dr. Jonas Leibowitz, an endocrinologist with 30 years of experience, here to review the Medicare beneficiaries that will be covered and eligible to receive the GLP-1 medications through the Medicare GLP-1 Bridge program. So again, these patients have to be 18 years and older and be in the Medicare program. They should be maintaining ongoing lifestyle intervention, such as physical activity and nutrition intervention. And then it is based on BMI, the body mass index. The group that I'll describe now is the group with a BMI of 30 or greater. And this group has to have one medical condition out of three possible medical conditions that we will go over. So first of all, BMI stands for body mass index, and it is a mathematical calculation based on height and weight. It is not a measure of fitness or muscle mass or fat mass. It is just a number, and it's a number that's used across populations to help make definitions. We say 30 and up is obesity, 25 and up is overweight, 18 to 25 is considered to be, let's call it a healthy BMI. So just for an example, for a 5-foot person, a weight of 160 pounds would be a BMI of 30. For a 5'8" person, a BMI of 200 pounds would be a BMI of 30. So that'll give you an idea of what 30 is for a BMI. So what are the conditions that a patient would have to qualify for a weight loss medication through the Medicare program with a BMI of 30? The first condition will be heart failure with preserved ejection fraction, which is commonly routinely called HFpEF. But what it means is that the patient's heart is not functioning as strongly as it could. The heart is a muscle, of course, but the heart does maintain the ability to release 50% of the blood that it fills with every heartbeat. So it's a preserved ejection fraction. It releases the amount of blood that's a normal level, but the heart isn't functioning normally. This is actually kind of an interesting criteria because more sophisticated testing would need to be done to prove that a patient has this. It's not just a blood test or a number that's measured like a BMI, let's say. So usually for this, to make the definition, and by the way, cardiologists debate what the exact definition is, the patient should have symptoms of heart disease. That could be shortness of breath, maybe swelling of the legs, things like that. They also should have the ejection fraction or the of 50% or greater. Again, that's the release of 50% of the blood that the heart fills with. And they should also have something on a clinical evaluation that'll say that they have heart disease. So it could be congestion, it could be atrial fibrillation, something that we call diastolic dysfunction, or an elevated level of a blood test called BNP or brain natriuretic peptide. So you need to prove that the patient has symptoms, and you also need to prove that the patient meets the criteria. Essentially, diastolic dysfunction or the heart failure or preserved ejection fraction often has to deal with the fact that when the heart is in a resting state, it has to fill with blood, and then it has to pump that blood up when the heart pumps. It has to release that blood into the bloodstream. And so in the resting state, when patients may have this problem, the heart muscle may be a little bit weaker and may not fill appropriately. So that's a little bit different than the heart failure people may think about when the heart is not releasing the proper amount of blood forward into the rest of the body. So this condition, again, is a little bit different and also may require more testing to prove that they have this criteria. The second criteria with these patients with a BMI of 30 would be uncontrolled hypertension. Uncontrolled hypertension could have many definitions, but specifically for this program, it'll be a blood pressure of more than 140/90 with a patient who is on 2 medications to treat blood pressure. So again, systolic blood pressure more than 140, diastolic blood pressure more than 90 on 2 medications to treat blood pressure. The third criteria that a patient with a BMI of 30 or more will need to qualify for weight loss medications under the new Medicare program that starts on July 1st of 2026 would be chronic kidney disease, stage 3A or higher. So 3A starts with a number called the glomerular filtration rate, or GFR, of 59. And if you ever look at a blood test that you have and you look at the chemistry panel, you may see a creatinine, which is a kidney function test, and the calculation can be done to estimate the glomerular filtration rate, and it's commonly done on your blood test, and your blood test results, you'll see it. And most importantly, it has to do with the age of the person as well as the creatinine level, and then a calculation is made. Simply put, 59 generally means that the patient is able to filter about 59% of the waste and the fluids that filter through their kidney to be properly disposed of. So that's really what 59 means. If you start moving downward from 59 and you go down to lower levels, even as low as 15 and 10, you start to move into levels where patients may need full kidney replacement therapy like dialysis. So the criteria is someone who has a moderately impaired kidney function and lower than that. This is kind of an interesting number because, again, as people get older, their kidney function declines. So some of the Medicare patients who are looking to be on a weight loss medicine on the new program may qualify as they age, even if their kidney function doesn't decline as much. So again, in summary, and this was a lot of detail in here, in summary, with a BMI of 30 or greater, there are 3 criteria that a patient will qualify for GLP-1 medications on the new Medicare program, and that includes heart failure with a preserved ejection fraction, uncontrolled blood pressure, and chronic kidney disease stage 3A or higher, or GFR of 59 or lower.